right, today we're going to be covering a specific topic in regards to a sports-related injury. We're going to cover kind of a younger athlete, their typical presentation, some of the things you may find along the way, some of the injuries that can occur in some common sports such as wrestling or football. And we kind of go over what can kind of happen and some of those injuries and how they'll present and kind of the whole progress and process of the whole situation. So what are the most common sports-related injuries? We have sprains and strains, which can be muscular or joint-related. We have something as shin splints that everyone's kind of heard of. Some of the most common knee injuries will typically be ACL, meniscus, or PCL. Some of those shoulder injuries in our, let's say, tennis players or swimming athletes will be something like a rotator cuff injury or tear. Or they could also have something as common as supraspinatus impingement, which causes kind of dysfunction and movement of the shoulder, depending on certain movement or actions and depending on the sport. Common ones are fractures and even dislocations as well. So here we kind of have a patient presentation, kind of a case I made up. It's going to be kind of a little background here, kind of give you some idea of what we're working with and what some of the similar presentations may be for a young athlete. So we have Aiden Macias, who is a 16-year-old male athlete with his primary competitive sport being wrestling. He plays contact football So here we have a typical patient presentation, kind of everything we're going to be going over, kind of give you a background, fake patient, some of the things you may see with a younger type of athlete, and some of the common mechanisms of injury. So here's a little bit of background. So we have Aiden Macias, who is a 16-year-old male athlete with his primary competitive sport being wrestling. He plays contact football in the summer to fall and begins his wrestling training right after the football season. He is participating in competitive sports all year round with a little bit of downtime. So he's training around 5 to 6 days a week, and 3 to 4 days out of the week he has 2 training sessions on that same day. So most of the time they'll call that 2-a-days. He's planning to wrestle in college and wants to be accepted into a D1 school that has a D1 program for wrestling. So Aiden has come into the office because he is presenting with low back pain. This pain has been going on for around 2 months and has progressively gotten much worse. So something you'll see with athletes, they'll tend to put it off, they won't get it taken care of right away, and then it tends to kind of compound and get a snowball effect, getting worse and worse and worse as time progresses. So he's unable to fully extend himself and has difficulty flexing forward. Any quick movements cause him a sharp pain in his lower back. So Aiden plays as a tight end and is interchanged with the lineman position. He wrestles at the 164 weight class, and he tends to gain weight for his football season and drops weight during his wrestling season. So we kind of see him in a surplus of caloric intake during the fall and summer for football, and then during fall and winter to even spring, he's in a deficit kind of issue. So Aiden has not seen anyone else other than his school trainer. His football coach has advised him to not see a doctor, as if he does, he may not be able to play in the upcoming games. You know, not all coaches are bad, but, you know, in some cases they will tend to push off having one of their main athletes go see someone or see a physician, as they don't want them to be out for the season. So if you are pressured in that sense, make sure you do get it taken care of and get it looked at by a professional. It could be something worse, it could be something minute. Either way, it needs to get taken care of and looked at. So Aiden is worried about the pain as wrestling season is coming up soon. So let's understand our patient a little bit better. So what questions should we ask them? What pertinent information will help us get a working differential diagnosis? And how should we approach this type of case? So some of the questions that might often be asked by the physician, kind of taking a look at so you can kind of get an idea of what's going on, is a pain rating on a visual analog scale. When did the pain first start? What does the pain feel like? So is it sharp? Is it dull? Is it burning sensation? Where is it located? They'll have you kind of specifically point to it. Does any position make it feel better or worse? How long does the pain last? Is there anything that alleviates the pain? Does the pain radiate anywhere? Meaning, does it travel anywhere down the legs? Is it kind of going up the back? Is it going to the sides, the hip, or the stomach? And have you taken anything for the pain? And if so, does it help? So kind of what we found out during the history was the pain at the midline of the lower back near the L1, L2 vertebra, so kind of just localized in the area. We don't know what's going on yet. The intensity of the pain is a constant 7 out of 10 and becomes a 9 out of 10 upon extension. So 1 being nothing, 10 being the worst pain you've ever had. So it's pretty up there when he kind of moves into extension. What is the quality? So the quality is a sharp and has a burning sensation. So something with sharp and burning tends to be associated with something like a fracture usually, unless it's more neurological. So the onset of the pain first began 2 months ago during football training camp. So this was a time strenuous activity when he was being kind of pushed a lot, having 2-a-day activities. They're trying to get the athletes into the season shape is what they kind of, try to get them into. The pain does not radiate. Nothing really alleviates it. Aggravating is kind of spinal extension and some flexion, and he has not had any associated manifestations other than not able to sleep well through the night. So kind of some social and past medical history. So he's not taking any medications. He hasn't had any surgery. The patient states no previous traumas other than the common sports overuse injuries. So something that most athletes will do is kind of omit some of the past injuries they've had, as they don't think it's pertinent to the specific case. So when you do go to your practitioner, mention everything from, let's say, you kind of had a pain in your lower back, you had a slight dislocation of a finger, whatever it is, just kind of, it may be pertinent to the case, it may be not, but make sure you do mention it when you go to your practitioner. Type 2 diabetes on his father's side. Mother's side, males are prone to heart attacks before the age of 60. High blood pressure on mother's side is common. No recent history of bacterial or viral infection. So this is one of those things we want to take a look at. If he is having back pain, is it some sort of meningitis? Is this some sort of osteomyelitis? Is this some sort of infection in the spine that can be tied to a previous infection? Let's say it's skin infection, specifically with football and wrestling. A lot of those tend to have really nasty skin infections just from the gear they use, the room they work out in, the mats they're on, whatever it is. So that's kind of a big red flag to be honest and upfront about as soon as you see your practitioner. So he does not drink, he's underage, smoke or use any recreational drugs, which is good. Patient has difficulty sleeping, especially when lying on his back. So kind of coming into what are we thinking, what is it that we're kind of seeing, kind of getting a understanding of what it could be. So some of the differential diagnosis, all this means is what do we think it might be, starting at the first one, and what could it also be as well. So at the top of our differential, we have spondylolysis, spondylolisthesis. We have facet syndrome, a disc herniation, vertebral end plate fracture, a lumbar sprain strain, so a lumbar radiculopathy, disorders of the lumbar spinal cord or nerve roots or plexus. So most times that you go into either, let's say, your primary care physician, chiropractic physician, or any type of other physician, they'll tend to do some orthopedic testing along to kind of get some sort of understanding with it. So range of motion is what ROM stands for. Normal lateral movement, so he can move normally side to side. He has slight difficulty with flexion, so kind of bending forward. Limited range of motion with spinal extension accompanied by pain. So any movement that he has kind of arching his back, he does have some pain. Bechterews is a test for lumbar disc or sciatic pain, so it's negative. So Kemp's test is a test for lumbar sprain or facet syndrome. That was positive. SLR or straight leg raise. He is a test for sciatic, lumbar pain, sacroiliac sprain, or tight hamstring. So this was negative. Well leg raise is meaning raising the leg of the unaffected side. So here we have centrally located pain, not specific to any side. It was negative as well. Patrick's test is a test for hip pathology or sacroiliac lesion, which is negative. Then we have Yeoman's, which is a sacroiliac lesion, was positive. And then we have Eli's, which was a sacroiliac lesion, which was positive. So the ones that were positive tend to put strain on the lower back. You can kind of see in the background picture there, that's Yeoman's. You kind of see pressure upon extension, so that would put pain upon the area that he's having an issue with. So we don't know if it's specific for that test or if there's just something going on in the area. At this point, we want to see what type of imaging would we order. So we could get an AP pelvis, which would be good for vertebral end plate fracture or good for visualizing the hip joints. An AP lumbar, which is good for vertebral end plate fractures as well, and also good for visualizing the anterior and posterior osseous elements. And we can get a lateral lumbar, which takes a look at the side view of the lumbar spine, which is good for vertebral end plate fracture, anterolisthesis, that's just a fancy word for meaning sliding of the vertebral body forward. And then it's good for visualizing the lateral osseous structures. And then we can get an oblique, which is specific for spondylolysis. So kind of taking a look at what we found here, we can start with the top, with the left image here. And as we kind of see, we have some sliding here of the L5 vertebra. And these are just kind of some cases and kind of ideas to show you what would happen in someone with this specific back pain or kind of injury that we're kind of making up and following along the prognosis of it. So we kind of see the anterior sliding. So I'd say this is a grade 1, grade 2 sliding a little bit forward. Let's see if I go back. Yeah, there we can see a little bit better. So so about a grade 1. So grade 1 anterolisthesis or spondylolysis would be anything that's 25% sliding more. So we have 25%, 50%, 75%, and the whole thing. So grade 1, grade 2, grade 3, grade 4. So we kind of take a look from the oblique imaging, and what we found is there tends to be something they call a Scotty dog sign. So we can kind of see the dog here, right? And when the neck of the Scotty dog is fractured, that means we have a fracture at the pars interarticularis. And that is a fracture that kind of holds the vertebral body in line. So I know this is not the same vertebral level, but this is kind of what we would typically see if someone had anterolisthesis or sliding of the vertebral body forward on a specific segment, causing them back pain. So we can go over the diagnosis and the cause, specifically spondylolysis and spondylolisthesis. So spondylolysis is a stress fracture caused by excessive hyperextension. It's most commonly seen in dancers, gymnasts, football linemen, and even in wrestling sports. So anything with a lot of extending of the spine and causing that stress on that spine to take the load. So spondylolisthesis is the progression of the vertebral body, spondylolysis, which causes anterolisthesis, which is sliding forward of the fractured vertebral body, or the fractured area of the pars interarticularis. So what are the main causes of this injury? So primarily it's sports-related activity caused by excessive stress through hyperextension of the spine. The root causes could be weak core muscles or weak erector spinae muscles. So the erector spinae are the ones that kind of pull you back and kind of make you go into the full-on extension. So if you think when you're deadlifting, you get tight lower back, those are the spinal erector muscles. Weak core muscles, we already know. So what's the primary treatment of this type of issue? So the main thing that the literature has pointed out is to refer out for orthopedic consultation and evaluation. Now, the big thing is to refer specifically to an orthopedic surgeon who does specific bracing techniques that is required for this injury. A lot of orthopedic surgeons don't do this primarily because they're focused on going into the operating room and doing what they've been trained to do. But some of them will have on the side that they do this type of bracing for spondylolysis or spondylolisthesis. And this is only recommended for individuals who are not done growing yet. If you are done growing, it'll heal over time. But for individuals who are still growing, so we have Aiden Macias, who is a 16-year-old male who's still growing, is not done growing, it is important to get this properly treated and fixed with a brace. Now, once the fracture has healed, it usually takes 4 to 8 weeks or 6 to 8 weeks, depending on the recovery of certain individuals. Then we can begin to work with the young athlete on proper form and exercises for core stability, fixing the root cause of the issue, which led to them being caused, or which led to him having a fracture. We know that this is a stress fracture, meaning that the muscles were not strong enough to take on the load. Thus, the osseous structures, or the bone structures, took the blunt repetitive forces which caused the fracture to occur in the first place. So what's our conclusion here? We know that this was a stress fracture caused by hyperextension. So we know that he is working as a tight end or a lineman. So they're kind of pushing up and coming into full-on extension every time they go in and push into these individuals. We know that there's some sort of muscle imbalance causing him to rely on the actual spinal vertebra to do what they're supposed to do, but over imbalance or under development of these muscles allowed for him to have this type of fracture. We know that the imaging is imperative because we saw in the orthopedic tests that nothing really pointed to a specific issue, whether it was Kemp's, but we knew that he had a lot of issue upon extension. So based off of the findings, we have a 16-year-old male who does a lot of extending sports. He plays as a lineman, he does wrestling. The whole thing points to having some sort of stress fracture on the vertebral body. So making sure that we get the proper imaging is imperative in this type of case to know what we are working with. A proper referral to an ortho who does bracing. We know that they need to follow the strict bracing protocol. So these braces are really strong and they kind of don't really allow you to move too much, but they need to wear it for the appropriate amount of time. If not, it won't heal correctly. One thing with athletes is they tend to be very stubborn. They don't listen, try to get back into play as soon as possible. They feel the stresses from either their coaches, their parents, or their friends to get into the position that they were trained to fill in order to compete competitively. And if they don't give themselves the proper time to heal, it's only going to get worse. And then one thing to consult with this type of individual is some sort of nutritional consultation. It tends to be something that's overlooked by some athletes, specifically the younger ones. As you get into the collegiate and the professional level, everybody's got it down to a science at that point. But as you're younger, it's good to go over what it is that you need to do, how to eat, how to prepare, and we'll kind of go over some of the ideas and recommendations that we would normally make to someone who's at this level. On that note, here's some personal advice that I would recommend as a former athlete. Is really always listen to your body. No matter who you are, no matter how smart the individual is, no one is going to know your body better than yourself. And if you have that internal voice or internal dialogue, that kind of knocking, scratching at the back of your head saying, hey, something's not right, listen to it, because you need to take care of your body. You are the Ferrari at this point. So make sure that you go in, get the care that you need, get soft tissue work, stretch, importantly, chiropractic care, whatever it is that allows you to function at your top performance. Get that taken care of. Listen to your body. And then something I call the duffel bag effect. Something that I always had with me was a duffel bag throughout my collegiate career as well as my high school career. You can talk to any of my friends. They always made fun of me. I always had a duffel bag with food, nutrition, anything that I needed to have a snack throughout the day. And this usually included some sort of supplements, and we kind of go over the most important ones real quick. Something as simple as a multivitamin, calcium, vitamin D, probiotic, fish oils, and something as simple as adrenal support, because you are competing at a competitive level and a high level at a constant rate. You know, if you are always redlining and you don't have the proper nutrition or the bolts and tools at this point, you know, you are going to break something, tear something. So you got to make sure that you have those nuts and bolts, which are in this case your vitamins and your nutrition, to be able to repair the tissues as they're being stressed on a continuous basis. So make sure that you have these supplements. I just put them up there, something you can get from either our office, or you can get it from the nutritional store, Walgreens, whatever it is. Just make sure you have some sort of basic nutritional pharmacy, in this case, that allows you to perform at a constant level and at a high rate. So kind of going over, I know that was a lot. I just want to give you guys kind of a atypical or typical presentation of some athletes and how they may present, what to do, how to go about it, what your doctor may do, what they'll see time to time, and how they'll end to treat it for the most part. So I hope this video was helpful and informative, and if you did like this video, please like, share, comment, and subscribe, as it is the best way to support our channels. Thank you so much, and I hope you have a wonderful day.